Ladies and gentlemen, you are all welcome to my YouTube channel. Today, we are going to look at the concept of diabetes mellitus. So, diabetes mellitus, it is a metabolic disease in which there are high blood glucose level over a prolonged period. So, generally, in diabetes, there is a normal blood glucose level. So, if the blood glucose level is above the normal range over a long period of time, then the condition is called diabetes mellitus. And the sugar that is found or that is usually found in the blood is glucose. So if the glucose concentration is high over a long period of time, the condition is called hyperglycemia. Mia means blood, it means high blood glucose level in the blood. And of course, if the concentration of glucose is low, then the condition is called hypoglycemia. So in the case of diabetes mellitus, it's when the blood glucose level is high over a long period of time. Like for example, if you can now see clearly, this is a glucose in the blood. This one in whites, it is the blood glucose level. The one in whites is the blood glucose level here. But of course, if you look at the concentration of the blood glucose level here, is very high. It's very high. That is excessive blood glucose. So if you have excessive blood glucose level in the blood over a long period of time, then the condition is called diabetes mellitus. So symptoms of high blood glucose level include frequent urination. So frequent urination, increase in thirst, and then increased hunger is a sign and symptoms of diabetes. So ladies and gentlemen, the most common symptoms that you can easily assess so that you can diagnose a person, or that you can know the risks of whether the person is actually having diabetes mellitus or not, is frequent urination, increased thirst, and then increased hunger. So these are the most common symptoms of diabetes mellitus. So it's a metabolic disorder, and of course it occurs when the blood glucose level is high. When the blood glucose level is high over a long period of time. Then now, if the diabetes untreated, if the disease is left untreated, so disease can cause many complications, because diabetes is linked with so many disorders. It's linked with ketoacidosis, non-ketotic hyperosmolar coma, or that the serious long-term complications include heart disease, stroke, chronic kidney failure, food ulcers, and damage to the eyes. In fact, diabetes, when left untreated, it affects everybody. So it affects every part of the body, every organ of the body. If the disease is left untreated, it can affect every part of the body. It can affect hearts, it can affect kidney, it can affect brain, it can affect eyes, it can affect eyes, it can affect ear, and almost every part of the body can be affected if the disease is left untreated. And diabetes is actually, usually diabetics is occur or is due to either pancreas is not producing enough insulin, or the cells of the body is not responding properly to the insulin produced. So you see, there are two conditions. One, the diabetes is occur when the pancreas is an organ of the body where the insulin is secreted. So diabetes can be due to increase. So they can be due to either the pancreas is not producing the insulin, or the cells of the body is not responding properly to the insulin. It means that the insulin is there, but the body or the cells of the body are not responding to the insulin. So these are the two reasons why diabetes occur in the body. And of course, we have three main types of diabetes mellitus. We have type 1 diabetes, we have type 2 diabetes, and we have gestational diabetes. So gestational diabetes is usually occur when the person is under during pregnancy. So we'll look at them one after the other. So let's start with type 1 diabetes. So type 1 diabetes results from the pancreas failure to produce enough insulin. So if the pancreas is failed to produce enough insulin, and of course it will affect the uptake of glucose. So therefore the glucose concentration will be increased in the blood. So now let's look at it very clearly. In the pancreas, we have different cell types. We have islet cells of Langerhans, we have beta cells, and we have alpha cells. And each of these cells have their functions. We'll look at them one after the other. And of course, this is actually the structure of the pancreas. So what happened? Let's look at how the disease occurs. So usually in type 1 diabetes, there is an insufficient insulin. So insufficient insulin is produced as a result of diminished in concentration of the insulin, and of course to affect the uptake of the glucose, because usually there are insulin receptors. So when insulin bind to the receptor, these are the receptors. So when insulin bind to the receptor, it will now invite the GLUT4 transporter on the surface of the cell. And this GLUT4 transporter, the major functions of the GLUT transporter is to allow the glucose to get into the cell. It's like a gate. GLUT4 is like a gate where glucose gets into the cell. But the GLUT4 transporter is not active. It's not active. So if it is not active, then what will happen? Then it means that if you have insufficient insulin, it means that the invitation of the GLUT4 transporter will be very low. So as a result of that, small amount of the glucose will only be taken into the cell. So it means that if small amount of glucose is taken into the cell, then what will happen? It means that those cells cannot produce enough energy using glucose. So as a result of that, fatty or beta or lipid metabolism will be activated. Lipids metabolism, because for the cells to survive, it needs a lot of energy. So if there is not enough glucose in the blood, especially the muscle cells and other peripheral tissues, then the lipid catabolism will be activated. The catabolism of lipid will be activated. So therefore, a lot of fatty acid will be break down to generate energy. So this is actually what happened in the case of type 1 diabetes. There is no sufficient insulin. So therefore, very small amount of the insulin can bind to the receptor. And this binding of insulin and receptor on the surface of the cells invites the GLUT4 transporter to be activated, which allow the glucose to get into the cell. So once it is inactive, then what will happen? Or once the amount of the glucose is very low, when the amount of the insulin is very low, it means that the activation of GLUT4 transporter will be low. It means that very small amount of GLUT4 transporter will be invited. So as a result of that small amount of the glucose, will get into the cell, while the remaining glucose will remain in the blood. So as a result of that, the blood glucose level will shoot off. That is what happened in type 1 diabetes. So let's look at, so sometimes the cause of this insufficient insulin production is actually remain unknown. So it is a lot of research are ongoing. So now let's look at the type 2 diabetes. So in type 2 diabetes, it begins with insulin resistance. So a condition in which the cells fail to respond to insulin properly. Like for example, here is a typical example where you have the cells here and the insulin here, but the cells is not properly responding to the insulin. So that is what happened. It's like a girlfriend, you want to propose to her, but she doesn't pay attention. So that is what happened. The insulin is there, it's trying to actually cooperate with the cells, to bind to the cells and invite more glucose to get into the cell, but the cell is not cooperating. So that is what we call insulin resistance, and it is the condition that leads to type 2 diabetes. So this form was previously referred to as non-insulin or non-insulin dependent diabetes mellitus or adult onset diabetes. So the primary cause is excessive body weight and not enough exercises. So excessive body weight, that is when a lot of lipid in the body, when you have a lot of lipid in your body, that is when you are obese. Obesity is a risk factor. Obesity is a risk factor of developing diabetes. So when you are overweight or when you have excessive overweight, the insulin will be produced, but the cell will not actually properly respond to it. So then what happened? We developed type 2 diabetes. Then, so now the next thing that we are going to look at is the type 2 diabetes. What happened in the case of type 2 diabetes? Let's look at it very well. So the type 2 diabetes is, as we said, is a metabolic disorder in which there is insulin resistance. So an impaired insulin secretion, and this leads to the high blood glucose level. So you see here, you have the insulin receptor, and of course, you have the pancreas here. So in a situation where you have the cells and you have the insulin, but the cells is not responding or is not properly coordinating with the insulin, then of course there will be an insulin resistance. So that will lead to an increase in blood glucose level. So that is what happens in type 2 diabetes. So what are the signs and symptoms of type 2 diabetes? There is excessive thirst, weight loss, frequent urination, slow hearing, excessive hunger, fatigue, blurred vision, and numbness. So that is why I mentioned this. Each and every organ of the body is affected by diabetes. It is a very dangerous disease. It affects a lot of body system. Almost every organ of the body is affected by diabetes type 2. So then, what are the functions of the of the pancreas? We need to understand that, of course, I have said it that, of course, the pancreas is made up of different parts. It can be exocrine and it can be endocrine. It has both exocrine function and endocrine function. So when you said endocrine, actually endocrine functions, it means that they produce hormones, and those hormones are not do their work at exactly where they are produced. They are produced and then they are transported through the bloodstream and carried out their function, and that is the endocrine. So in the pancreas, we have alpha cells, we have beta cells, and the delta cells, and each of them have specific hormones that they excrete. Like alpha cells secrete glucagon, beta cells secrete insulin, then delta cells produce somatotropin. So each and every uh, cells in the pancreas have its own function. And of course, we have the exocrine. So for the exocrine functions of the insulin, what is so the major differences in terms of the exocrine? It is actually excretes or it secretes a substances into the duct. And then after this is excreted, like for example, this one, they are secreted through the duodenum ducts and then they carried out their functions onto the surface of the target organs. That is what they do. But in the case of endocrine, it creates proteins through the blood and then transported to their target organs. So most of actually example of the exocrine molecules are digestive enzymes. So now how does insulin work in the body? So you see here we have insulin and we have the receptor. So the insulin, when insulin binds to the receptor, so binding of insulin recruits GLUT4 from the GLUT4 storage vesicles to the plasma membrane. So once it is recruited, this is the GLUT4, this is the GLUT4 vesicles or storage vesicles. So GLUT4 storage vesicles will be activated and then the GLUT4 will be recruited into the signal that was sent by insulin. So therefore, so when this happens, then of course the glutathione transporter will be recruited on the surface of the cell membrane, which allow the intake of glucose into the cell for glycolysis to take place for the generation of energy. So then let's look at the pathophysiology of the type 2 diabetes. So insulin receptors on the surface become resistant to insulin, so it doesn't respond to it. So this is what happens. So when beta cells produce the insulin, then of course the cells is not responding to the insulin. So therefore the receptor is not responding to it. So therefore as a result of that, there is a compensatory increase in insulin production and secretion. So of course the insulin secretion increases, and of course it will remain there in the pancreas because it's not actually utilized. So as a result of that, this will lead to the accelerated beta cell changes, damage, and then decreased insulin secretion. So as a result of that, look at it, it is now damaged, the pancreas is damaged, and therefore the insulin secretion will actually insulin secretion decrease. So the insulin resistance and inadequate insulin secretion lead to type 2 diabetes. So as a result of that, there will be an increase in insulin resistance and decrease insulin secretion, and of course lead to increase in blood glucose level, and that what lead to diabetic condition type 2. That is diabetes mellitus type 2. So then we need to actually know the diagnosis of type 2 diabetes. So we have different ways of measuring type 2 diabetes. We have a way of measuring, measuring glycated hemoglobin. That is, when we say glycated hemoglobin, is the hemoglobin that is binded with a glucose. We call it glycosylation. We have what they call it glycation. Yeah, glycation is the addition of, or is a binding, or is a non-covalent interaction of hemoglobin with glucose. We know that the major functions of hemoglobin is to bind oxygen and transport it to different parts of the body. So, but when the blood glucose level is high, then some of these glucose now bind to the hemoglobin. And of course, as a result of that, the function of the hemoglobin will decrease. So therefore, in terms of the oxygen transport, it will also decrease. So it will affect that. So it means that diabetes can be also associated with anemia. So it affects red blood cell. So you can measure actually the amount of the glucose that binded to oxygen, that is glycated hemoglobin. And you can also measure fasting blood sugar test. You can do also oral glucose tolerance test. And you can also do what you call random blood glucose sugar test. You can do that. So these are the types of the case. So these are the types of the tests that you can actually carry out for the diagnosis of type 2 diabetes. So using a glycated hemoglobin test, this blood test indicates an average blood glucose level for a first 2 to 3 months. And sometimes the best way to measure or to diagnose type 2 diabetes is to use the glycated hemoglobin test, because that will give you an idea of the average blood glucose level for a first 2 to 3 months. It means that the blood glucose level, of course, reach that very long period of time, and that will give you an idea to know exactly how long the person is actually developed with the diabetes mellitus. Because you can generally, once we take a diet, when we eat, there is a higher chances that our blood glucose level will go high. But when you are able to measure the glycated hemoglobin, that will give you an idea of the average blood glucose level for about 2 to 3 months. So that is why sometimes it is more advisable to go for the glycated hemoglobin test. And of course, when you undergo this glycated hemoglobin and when you realize that the blood glucose level is less than 5.7%, that tells you that the person is normal. And if it is between 5.7 to 6.4, it tells you that the person is pre-diabetes. And if it is, of course, above 6.5%, it means that this indicates that the test or the person is having diabetes. So, and then the next one we also have, and sometimes if the glycated hemoglobin test is not available, or if you have certain conditions that interfere with a glycated hemoglobin test, then your healthcare provider might use the following test to diagnose diabetes. So it is the best. But if the glycated hemoglobin test is not available, then of course you can undergo a random blood sugar test. So in the case of random blood glucose test, is a blood sugar values that are expressed. Usually it is expressed in milligram per deciliter. Yes, milligram per deciliter, or it can be measured in millimole per liter. So regardless of when you ate, regardless, that is why we call it random. So if the level of the blood glucose level is greater than or equals to 200 milligram, so this suggests that you have diabetes, especially if you also have symptoms of diabetes, so such as frequent urination and extreme thirst. So the random blood glucose level is irrespective of when you eat. It is random. Your blood glucose level will just be measured. Whether you eat now, you eat 1 day or 2 days, it will be taken at random. So if it is above 200, or if it is above or equals to 200 milligram per deciliter, that indicates that you have diabetes. Yeah, so there is no issue of whether normal or pre, it will just be taken at random. And then the next one that is also the next diagnosis is the fasting blood glucose level. So a fasting blood glucose level is taken after you haven't eaten overnight. So usually maybe after you eat, you slept maybe early in the morning, your blood glucose will be taken. So that is the fasting blood sugar test. After you haven't eaten overnight, then you take the blood glucose level. So if it is actually less than 100 milligram, it means that you are healthy. And if it is between 100 to 120 milligram per deciliter, it means that you are pre-diabetics. And if your blood glucose level is greater than 120 milligram per deciliter or 7 millimole per liter, it means that you are diabetics. And then the next diagnostics is also oral glucose tolerance test. So this test is less commonly used than the others, except during the pregnancy. So you will need to not eat for a certain amount of time and then drink a sugary liquid at your health care provider's office, and then the blood glucose level then are tested periodically for 2 hours. Then the results are interpreted as follows. So usually the oral tolerance test or the oral glucose tolerance test is not usually used. It's not used, but except in a situation where there's a pregnant woman, then you need to eat. You need not to eat for a certain period of time. You will not eat for some time. So if you didn't eat for some time, then the healthcare providers will give you the sugary liquid in your office, and then in his office. And after like 2 hours, then you will now take your blood. So if it is less than 140 milligram or 7.8 milligram per liter, after 2 hours, then it's considered healthy. And if it is between 140 to 199 milligram per deciliter, it suggests that you are diabetics. So this is actually the different tests or diagnosis tests that use in testing blood glucose level. So, and of course, in the next video, I'm going to introduce us to and how to carry out these different tests. So then, the next one is gestational diabetes. So gestational diabetes is the third main form and occurs usually in pregnant women without a previous history of diabetes. So generally, as I said, this diabetes affects so many organs. Like for example, this is diabetes type 1. So in the case of diabetes type 1, what happened? Then the pancreatic cells, there will be maybe a destruction of the beta cells, which cause insulin deficiency, So as a result of that, there will be reduction of blood glucose utilization by so many organs like adipose tissue, muscles, liver. And of course, as a result of that, since so many organs are not making use of the glucose, then a condition called hyperglycemia will occur. So the high blood glucose level will be high. The blood glucose level will be very high. And as a result of that, the kidney will be affected. Ketonuria, that is ketone bodies, and glucosuria. But why ketonuria? Of course, if for example, if brain is not actually utilizing, or if there is no enough insulin that will supply enough glucose in the blood, in the brain utilize ketone bodies, apart from the glucose in the body. So therefore, because of that demand, a lot of ketogenesis will take place. So a lot of ketone bodies will be generated so that the brain will utilize it for it to survive. So as a result of that, a lot of the ketone bodies will be excreted in the urine, and that will lead to a condition called ketonuria. And then, of course, when you said ketonuria, it means excretion of ketone bodies in the urine, and there will be glycosuria, glycosuria, that is sugar in the blood. So then, as a result of that, there will be polyuria. There will be polyuria. What is polyuria? That is excessive urination without drinking large amount of water or any fluids or taking any medication. So there will be a lot of that. So as a result of that, there will be volume depletion. So this will actually affect, will cause what you call diabetic coma. So you see, you should understand that actually as a result of insufficient amount of the glucose, like in the liver, since liver can actually generate glucose on its own, so there will be a lot of gluconeogenesis that will take place. Gluconeogenesis will take place to provide enough glucose. So you see, glycogenesis, that is synthesis of glycogen, will also be blocked. Sorry, I just wanted to say glucogenesis, that is the synthesis of glycogen. It will also be blocked because even the liver itself cannot uptake the glucose. So therefore, there will be diabetic ketoacidosis. So we should understand that diabetes is associated with many. So actually, when we say diabetic ketoacidosis, it is actually a condition when the body cannot produce enough insulin, as actually happens in the case of type 1 diabetes. So therefore, we know that glucose is a major source of energy. So without enough insulin, the body will begin to break down a lot of fatty acids or a lot of fat as a fuel. So this causes a build of acid, that is the fatty acid that is coming from the fats in the bloodstream, and this causes what you call ketones. So if it is left untreated, the build of can lead to diabetic ketoacidosis, because a lot of ketone bodies, because glucose are not utilized, so therefore a lot of fatty acid will be accumulated in the blood, and that will lead to a medical condition called diabetic ketoacidosis. And as a result of that, it can also lead to diabetic coma. And then the next thing after this is enhanced protein catabolism. So you see, since there is no enough glucose in the cells, like muscle can enhance protein catabolism, because protein can also provide energy in the body. So as a result of that, the body will now activate protein synthesis, catabolism of protein. So a lot of amino acid will be degraded. It will be break down, and then, of course, all this occurs as a result of insulin deficiency. So protein in the muscles catabolism will be enhanced, so that amino acid will be used to generate energy in the muscles. And then also in the adipose tissue, there will be an enhanced lipolysis, that is breaking down of fatty acid. So as a result of that, a lot of fatty acid will be accumulated. So this also leads to reduction of glucose utilization. So then comparison of type 1 and type 2 diabetes. So onsets, the type 1 diabetes is sudden, but type 2 diabetes is gradual. Each at constant, mostly in children, but this one is mostly in adults. then body size, thin or normal. But in the case of type 2 is often obese. Then ketoacidosis is common in type 1 diabetes because as a result of insufficient insulin, a lot of ketone bodies will be generated, which actually lead to build of a lot of ketone bodies in the blood or fatty acid, which lead to diabetic acidosis. So it is rare in type 2 and O2 antibodies, so it's usually present while it is absent in type 2 diabetes. Then endogenous insulin, so low or absent, and of course the normal decrease or increase. So then the next one is concordance in identical twins. So it's 50% while 90%, but the prevalence is 10%, while type 2 diabetes is 100%. Sorry, it's 90% prevalence. So these are actually some of the signs and symptoms of the diabetes. These are some of the signs and symptoms of diabetes. Number one, central, so it leads to polydipsia. It also leads to polyphagia, lethargy, and cause stall fall. The affect eyes, breathing. It usually lead to the smell of acetone. So acetone is one of the ketone bodies, and actually more common in type 1 for blue eye. So there will be a blue eye, so you can easily know whether someone is diabetes based on the blue eye, but most common in type 1. And there is weight loss, there is nausea, vomiting, abdominal pain, there is polyuria, there is excessive loss of urine without taking large amount of fluids. There is also glycosuria, that is glucose in the blood, and there is also small breathing, which is hyperventilation. So these are some of the signs and symptoms of diabetes. So the classic symptoms of untreated diabetes are weight loss, polyuria, that is excessive urination. Then we have polydipsia, which is increased thirst, and polyphagy, which is increased hunger. So these are the most common signs and symptoms. So of course, the symptoms might develop rapidly, weeks or months, and in type 1 diabetes, while they are usually developed much more slower and may be subtle or absent in type 2 diabetes. So these are the signs and symptoms. In addition, they also include blurry vision, headache, fatigue, then slow healing of cuts, and itchy skin. So prolonged high blood pressure can cause glucose absorption in the lens of the eye, which lead to the changes in its shape, resulting in vision changes. So you see, this is what happened because there is an increase in the absorption of glucose by the lens of the eyes, which affects the vision. And then the number of skin rashes that can occur in diabetes are collectively known as diabetic dermatomes. So this is so all forms of diabetes increase the risk of long-term complications that are typically developed after many years. So the major long-term complications relate to its damaged blood vessels, and it also diabetes doubles the risk of cardiovascular disease, and about 75% of deaths in diabetics are due to coronary artery disease. So there is also other macrovascular diseases, stroke, and peripheral vascular damage. So ladies and gentlemen, we are going to stop here, and we are also going to look at the management of the diabetic mellitus in the next video.